Medscape Oncology is here at the National Comprehensive Cancer Meeting in Hollywood, Florida. This is the 13th annual conference featuring clinical practice guidelines and task force recommendations.
Very quickly, a little quick news from NCCN.
The guidelines, which have been gaining popularity among physicians, cover the management of an estimated 97% of all cancer patients.
The NCCN has gained importance because it's a very unique organization that has provided not only expert content, but the necessary structure to create a continual review of cancer guidelines, which are web-based and free to all.
Physicians from a wide range of centers are participating in the meeting, and some doctors, especially those from community care facilities, say what they learn here is vital.
I'm coming to this meeting, the NCCN, almost since it was formed. Every time I have come, for the reasons that there are the major institutions, the research institutions, there's 13 institutions, they bring the teachers, the professors that they are doing constantly, and the fellows that they are writing. So we keep updated.
For busy, practicing clinicians, new advances are freely available online. Doctors can use updated practice guidelines during office hours or as reference material later in the day. This open access presents a wealth of opportunity for professional collaboration.
To me, it's very important. The communications and the information that I get in NCCN is very important in the community. In any small hospital or any small community, even in large institutions, other universities, not just only in Pennsylvania, but across the country.
Concern for patients was a sentiment that echoed throughout the meeting. Sam Donaldson from ABC News was among the many presenters.
Well, I'm here today because I think this organization does a terrific job of saving lives. I mean, that's simply put, but that's the bottom line. By publishing guidelines that are consistent all around the world, really. Oncologists all around the world can know what the latest therapies are, and that, of course, will save lives. I'm here because I was invited to moderate a panel. The panels have always been filled with interesting, informative people, and that was true today.
Donaldson's session was about how the Internet is transforming doctor-patient interactions. Panelists in the roundtable session included physicians, web-based professionals from industry, and government and patient advocates. The lively discussion was often heated and was a highlight of the meeting. After the session, Donaldson spoke to Medscape Oncology about his personal battle with cancer.
Well, I'm a member of the Cancer Club. It's a club that no one sends in an application and says, I hope the board will allow me to join. You're drafted. My division is melanoma.
Experts rolled out updates in a variety of key areas: prostate and breast cancer, CML, and colon and rectal cancer, among others.
At our annual meeting, we carefully choose which of our many guidelines we will focus upon for each meeting. So, for example, if a guideline has had a major review and updating, it's very appropriate to present what changes were made and to explain the rationale, as well as including new data that help guide the treatment recommendations encompassed into the guideline.
The guidelines are available online at nccn.org, and Medscape is carrying complete multimedia news coverage of the meeting. I'm Allison Gandy for Medscape Oncology.